Welcome to the Birds and the Bees podcast. This is Braxton Dutson.
That's the key. People aren't talking about it.
Everybody needs to know that porn is not a documentary.
It's not like if we don't talk to kids about sex and sexuality, they're not going to hear about it. They're just not going to hear about it from us.
They have tons of questions, they just don't know how to ask them.
All you have to do is be one chapter ahead. You don't have to know everything. Just one chapter ahead of wherever your child is.
Welcome to the Birds and the Bees podcast, episode 7. Real excited to have you here listening to this podcast today. We have a really wonderful guest that we're about to get to. Her name's Paige Zuckerman. I've got to see a lot of the cool things that she's done, specifically when it comes to education, awareness, and we got talking months and months ago about fertility and her experience of being diagnosed with premature ovarian failure. And I wanted to get her take on what her experience was like and what she wants other individuals to know, to understand that you might have kids that could be facing the same thing, and it might not be too bad of an idea to talk to your kids about fertility or having them checked for possible issues that could come up for fertility. We end up talking about a lot of different experiences she had, and her story is just phenomenal. The way that she went about coping with the issues that she was going through, specifically after the diagnosis, how she was diagnosed, what she wants everyone to know about infertility, as well as we start talking about shame over sterility. We covered a lot of different topics and some really great conversation we had with her, especially around her experience going through this firsthand. You know, it can be really uncomfortable when you're someone that, when your loved one or someone you know that's close to you is going through this difficult part of life. So I'm really excited to get over to this interview that I had with Paige Zuckerman. If you have questions specifically for Birds and Bees about fertility, about anything that we want to hear, we want to hear from you. We want to hear what your experience was. Drop us a call at 385-449-1818. Leave a message. No one's ever going to pick up the line, but we want to hear what your experience has been, whether positive, whether negative. If you have questions, if you want some other questions addressed on another podcast, we would love to hear from you. You can also find us on Facebook at facebook.com. Just search out Birds and Bees Podcast, or you can email us at birdsandbeespodcast@gmail.com. So yeah, be in contact with us. Be sure to be looking for future shows coming out as well. We've got Intimacy that is coming up on our list, as well as some exclusive interviews that you can get access to if you sign up for the Rocky Mountain Sex Summit that's happening in September, here in the next couple weeks from when this podcast was released. But September 22nd, 23rd, 2017, you can get exclusive interviews from Marty Klein, Tina Sellers, and Al Vernacchio. And you can get the exclusive interviews by signing up at RockyMountainSexSummit.com. Without further ado, this is episode 7 of Birds and Bees Podcast. We hope you enjoy. So I'm here with Paige Zuckerman. She's a CMHC, and she specializes in women's health issues, specifically with chronic health concerns. And she's also a member of the infertility community, both personally and professionally, which is why we have her here on the show today. We're really excited to talk about fertility, infertility, education, and awareness. Thank you for coming on the show, Paige.
Thanks for having me, Braxton.
Oh, I'm really excited for this one. We've been talking about doing this show for, it's probably been over half a year.
Yeah, at least 6 months.
Yeah.
The egg started hatching a while back.
Yes, it sure did. And it's cool that we're actually finally making the jump on this, and I'm so excited for it.
Awesome.
So some of the things that as we start talking that intrigued me at the very beginning when you and I were talking about this idea of having a podcast specifically around fertility, education, and awareness is essentially wanting to know when someone should start focusing on fertility. A lot of the time we start talking about it specifically when someone's about to get married. Mm-hmm. And it's like, oh, well, the babies are coming.
Mm-hmm.
And from what you were saying, that can also be too late.
Yeah. I think it certainly depends on the average age of marriage, but I think nationally it's somewhere around 25 if we kind of look at the U.S. in aggregate. And I think it's socially accepted that most people in their early to mid or even late 20s are going to be of normal fertility. And as it turns out, the reality is something very different. And age isn't necessarily always correlated with the ability to conceive. But we don't usually educate that, like you said, until people are at that point when they're getting ready to settle down, as they say. And sometimes settling down might be a little bit too late in the game. So I'm a big fan of starting to look at that picture a little bit more proactively.
Gotcha. So it's not necessarily being worried after the age of, 35, when people are like, oh, you're going to start having problems with fertility.
Yeah, so 35 is kind of in the medical community considered to be the point at which you become what's classified as a high risk conception or pregnancy. And that's also when, at least we have some understanding that ovarian reserve, egg quality, those kinds of aspects in women tend to go down.
Yeah.
And certainly for men, sperm quality, count, morphology, all that stuff is also going to decrease around that time as well. And there are realities that go beyond that, I think, that normal time span that we understand in the medical community.
So it goes beyond what we are normally thinking of as normal.
Yeah, the standard expected time when fertility is going to be difficult. There's other things to consider along the way.
So what are some of those things that we need to start considering?
Yeah. As it is, about 20% of couples who are trying to conceive are going to have a significant fertility complication. So we're looking at 80% of people are going to fall within the normal range of fertility, but 20% of the population, or 1 in 5, is going to have a significant problem and is going to require medical treatment to manage their fertility. Then there's male factor fertility problems as well as female factor fertility problems, and they kind of move across the board in terms of how common they are, how severe they are, and there are even cases of unexplained infertility where couples, one or both parties, cannot conceive.
And they have no idea why.
Yeah, and sometimes there isn't an answer, and sometimes it responds to fertility treatment, sometimes it doesn't.
Oh, wow.
Yeah.
So there's just so many different things that could come up, and we're not thinking of it until you fall into that 20% or that 1 in 5.
Yeah. Oftentimes, the stories that I hear, including my own, were, we'd been trying to conceive for a significant period of time. And, one day we went to the doctor and we decided to run some different tests and look a little bit deeper after maybe a year or year and a half of trying to conceive, and discovered that something a lot more insidious had been going on. And generally in the medical field, about a year is required of trying to conceive before fertility specialists will even entertain looking any deeper. So oftentimes, you'll go to an OBGYN as you're starting the process, and they'll look at the very basic protocols, and maybe if you've been on birth control or you haven't, or there's other factors there, they will try to kind of clean the slate, and then they'll give it 12 months of trying to conceive before they will even start to cross the bridge of possibility that there could be something else going on.
And that gets shorter at, is it after 35, if I remember correct? It'll become 6 months?
Yeah, oftentimes after the age of 35, if an individual is trying to conceive at that point, that they will usually initiate fertility treatment much more quickly if an individual hasn't conceived within the 6-month period. So they tend to push that. And some doctors will even tell you should probably go talk to a fertility specialist immediately, just right out of the gate, for some of those risk factors.
Gotcha. So what was the protocol for you then? You said that you fell into this. What did you end up finding out?
Yeah. I'll go ahead and kind of go right into my personal story, and then we can talk about kind of the some of
if
the
you're all right with
medical
that.
stuff. Absolutely. Yeah.
Awesome.
Yeah. I want to preface this by saying that it's been really valuable to me as somebody who has dealt with infertility on the personal level to be really open in conversation and dialogue about that, and really share those discussions pretty publicly, because there is still a lot of shame that happens for people around the idea of not being able to conceive, and particularly people of my age. I'm in my early 30s. So I'm a big proponent of talking about it, not keeping it silent.
Well, I'm really glad that you're open to talking about it. It's something that does need to be talked about.
Yeah, absolutely. So, I was married in my late 20s, after spending 10 years in school to get all of the education and training required to be a therapist. And I had been on birth control, specifically a form of birth control that was progesterone only, and it was called Implanon at the time. I think it has a different name now. It might be Nexplanon is kind of the standard. I don't know if that's the generic name, but it's a progesterone implant that they insert under the skin. And about, I think, 25 to 30% of women who utilize this form of birth control will cease menstruation within a couple months of having it inserted. And I had had it in for, I think, 2.5 years by the time I got it removed. And I thought that I was one of those people who just stopped having periods while they were on the implant. And there was no reason for my doctor to think otherwise. She just, at one of our appointments, I think 6 months after getting it implanted, said, "Oh, you're one of the lucky ones. You don't have to deal with a menstrual cycle while you're on this." And I'm thinking, great, that's a deal for me.
Phenomenal.
Exactly. And at the time I was in my late 20s. I think it was 27 when I got the implant put in. So there was just no reason to think that anything unusual was going on. And it was about probably, I want to say 6 months after I graduated from graduate school and started my first job as a therapist, that I started not feeling well.
Oh.
And that, I think that was in 2015. And that year I ended up having a couple of ER visits because I would have these weird episodes where I would just feel like I was going to pass out. I would have like a flop sweat, like hot flashes, just really not feeling well, terrible headaches. And I'm prone to migraines and have had them since I was 10. So for a while, I think a couple of my doctors, including a neurologist, suspected that it was just sort of a new variant of migraines that could have been age related or something. And so I was, after a couple of ER visits where I was really not well, I was just kind of sent away with the whole, well, look into your migraines. That's probably what's going on. And while this was all going on, I had the implant removed because I'd gotten married and my partner and I were planning on trying to conceive. So all of this is kind of converging at the same time. And I'm just thinking it's kind of all a fluke. And I've had health problems kind of for most of my life effectively at some level or another. And so I just kind of figured, well, this is the name of the game for me and I'm just going to have to roll with it. And it was 1 year into us trying to conceive. And I had the implant out for 1 year. And when it was removed, my doctor said, well, 3 to 6 months on average for your body to re-regulate. Here I was a year into having it removed and I still didn't have a menstrual cycle.
Oh, wow.
And I was 30. And there was before I had the implant put in, I had normal menstrual cycles. There was no historical indication that was going to suddenly stop.
Just out of the blue. Out of the blue, not necessarily, but at the same time, should have come back. Right.
It absolutely, by a year, it should have come back. And I remember having the 1 year appointment with my OBGYN, and she kind of started sort of naming off a bunch of different possibilities of what could be causing the amenorrhea. And the last thing she said was, worst case scenario, it could be that you've gone through early menopause, but that almost never happens. It's about 1%.
Really?
Yeah. And so I was like, 1% of the population of my age would have the worst case scenario. That couldn't possibly be me. Right. So she goes, we're going to run some tests. And, they do the tests. And it was the December 28th. So it was just a couple days after Christmas, right before New Year's. And I get a call from the doctor on a Tuesday morning before I'm headed into work. And she says, we need to talk to you. It looks like you might be in the worst case scenario situation. We're so sorry. Based on your blood tests preliminarily, it appears that you have already gone through menopause and that you're not going to be able to conceive. I was 30 years old.
Wow.
Yeah. And I was just turning 30 at that point. So I was just rounding the corner.
Just rounding that milestone. Holy cow.
Yeah. Yeah. It was surreal. I called all my clients that day and canceled, and I just kind of hung in devastation for a few days. But that day, it was so interesting to just days before have had a doctor kind of go, oh, no, it's not likely that you're, worst case scenario. And then to have them
1 in 100.
Yeah, and have them come back and say, actually, you are.
Wow.
Yeah.
Yeah, that's definitely pause for trying to get your bearings on whatever that means. Where it's like, we were looking at so many other options. We're going to jump to that one.
Yeah.
Wow.
Yeah, and it was 2 blood panels was all it took to confirm what was going on, alongside an examination at that point of the broader symptoms. And it was funny, there were even, as I started to think about it over the ensuing days after I got my diagnosis, I started putting the pieces together, including little random things like the fact that I'd been to a dermatologist's office 6 months earlier for my standard, skin cancer screening. Mm-hmm. And she was looking at my scalp and she was saying, at what point did you start losing your hair? And I remember thinking, what is she talking about? Losing my hair? It's like, and then I kind of remembered, like, I had been noticing a little bit more hair coming off in my hands in the shower, and had been that way for like the last year. Mm-hmm. And I didn't really make anything of it. I just thought, I've kind of let it get long. It's just getting tangled and messy. But then I started to backtrack to all of the signs that something had been going wrong, and then the hospital visits and the weird episodes I was having, and it all kind of came crashing down into a realization that like something really insidious and powerful had been happening to me for a couple of years that I hadn't even known.
Really?
Yeah.
So looking back, all the symptoms, puzzle piece together.
Absolutely.
I'm like, oh, okay, that makes sense.
Yeah.
Was there a point in time that, like even the doctors, that they were disbelieving and like trying to keep you on the up and up, or did the blood test really just like solidify it and they're like, yeah, we're sorry about this?
It was pretty immediate. That I think I had 2 phone conversations that same day, both with the nurse practitioner from my doctor's office, and then the doctor herself called me that evening after hours at night. I mean, basically having a very, kind of a very deep conversation with me about like, look, this is not good. Mm-hmm. And I think we came back maybe a week later, my partner and I, and sat down with her. And this is one of the things that I think in this process has kind of burned itself into my brain is she, in our appointment, she started crying.
Really?
And like apologizing for the fact that like we didn't see this coming. We didn't like, I'm so sorry that we didn't think that this is what could have been going on, because maybe we could have done something different along the way. And it was really fascinating too, as it turned out. It turned into this really interesting interpersonal experience where she acknowledged that she had actually, she was an older woman and had tried to have children later in life, and had IVF, had become pregnant with twins, and then stillborn those twins. And then a couple of years later, and was actually in the process of adoption the day that we saw her. And she said, my little girl is going to be delivered in a week to me from like Afghanistan or something like that. So she's just crying and having this like powerful emotional experience with us. Mm-hmm. And I think I was just a deer in headlights, 'cause I'm like, my doctor is the one crying right now because this touches her personally at such a profound level. Oh yeah. But also she's clearly very familiar with how terrifying an ordeal it really is. So that was one of those experiences along the way that was really, really fascinating. And actually I have a profound amount of respect for Dr. Shannon Tilley at the Intermountain Women's Clinic for being not only an incredible ally, but having in that moment gotten really, really personal and real with me, which I don't know that all doctors would do, because, it feels like one of those medical ethics moments where it's like, should I self-disclose? Should I not? Mm-hmm. But that was exactly what I think my husband and I needed to hear at that moment.
It's wonderful that she was there in that aspect.
Yeah. Yeah. She was kind of the perfect person to deliver the message, because she knew deeply what it meant.
Mm. Did she ever end up coming back, saying like we could have, was there things that could have been done differently, or is this just kind of like, wow, this happens and I'm sorry?
I don't believe for a moment that she could have seen what was coming. Again, I tell people now I'm like there was this meme online. It was a rainbow unicorn butterfly kitten. It's like this cute thing that I love to death. But I joke to people, I'm like, I am that thing. Like I'm, when they say when you hear hoofbeats, you think horses, not zebras. Mm-hmm. And it was the same kind of thing. Like, why would they have thought zebras in that moment? There was no reason for my doctor to believe that I was a case of the zebras. Mm-hmm. So I think I wouldn't have expected her to see it coming. I wouldn't have expected myself to see it coming. I think I probably could have advocated for myself a little differently when things started to feel wrong earlier on. Mm. But I think there's also, the power of avoiding the things that frighten us is really profound. And one of the things that I said in the kind of the days after I got my diagnosis, to my partner, my family, a couple people, was like, this was one of the things that I was the most afraid of in my whole life, was that I was not going to be able to have children. Mm-hmm. Not that, just that I was not physically going to be able to make them. And it had crossed my mind very, very briefly here and there throughout my lifetime, but never in any kind of way that felt serious. So it was kind of like you're waking up in the middle of the night to a, 10.0 earthquake, and all of a sudden realizing that everything you thought was safe about the world
is not.
It's just not.
Yeah.
You can't stand on that ground anymore. And that was really, really frightening. And I think because I had, at some level, always carried a fear that could be something that would happen to me along the way, but didn't really believe that it would, it was very easy for me to gloss over the things that could have been signals. And I think somehow along the way I managed to sort of bleach my red flags to white.
Oh, yeah.
And that, I don't blame myself. I don't shame myself for that, nor do I blame anyone else in the process for it. But it is one of the reasons that I'm so passionate about having conversations about this, because I just don't want to see other people have to suffer that if there is a way that we can avoid it.
Well, and it sounds like it comes down to the whole hindsight 2020 type thing, where people start to see all the red flags afterwards that were bleached white.
Yeah, absolutely.
And then really start to loathe that action instead of looking at it with compassion, being like, does anyone really want to see this red flag at this point in time of your life, or at this thing? Like, you're doing your best. And same with the doctors, noticing that there's something going on, but not jumping straight to the 1 in 100. And then in the retrospect, being able to say, oh, I guess we could have known in that moment. But in reality, it's the same thing with what we do with our lives each and every day. It's really easy. You can beat yourself up over so many things, when looking at yourself in compassion is where you need to go.
Absolutely. Yeah. Compassion and then conversation.
Compassion and conversation.
Yep.
Totally. So with this, your story, is this when you started getting into working with women that have had chronic pain as well as infertility?
Yeah, so actually I had sort of picked up the mantle somewhat by accident of working with not just women, but people in general that had chronic health conditions, medical trauma, chronic pain conditions during my internship at the University of Utah Women's Resource Center. For some reason, people would come to me who had amazing stories of survival. And I mean, some of them were just absolutely stunning. And that year we presented a conference on invisible disability, myself and my colleagues. And so it's just sort of like this act of quantum entanglement that I managed to find myself into this role. And it was funny because at that point I had familiarity with what it meant to have health problems, because I'd had severe migraines since I was 10 and whatnot. And I was born kind of a sick kid and had problems from the very start. So I had a familiarity with it. But fascinatingly enough, as a result of this experience and the other complications and kind of associated conditions that I'm facing in my lifetime with my diagnosis, it was interesting the way that I managed to further step into an awareness and identity of what it means to struggle with a chronic health condition that's really devastating and that's lifelong, and where I have to take medication every day for probably the rest of my life. And what my official diagnosis is premature ovarian failure, or POF. And most cases of POF are caused by an autoimmune factor. And as it is evidence, at least as far as we know at this point with me, that's the case.
Okay.
We found antibodies in my bloodstream, including against my adrenal glands. So I have about a 50% risk of developing something called Addison's disease, which is basically failure of the adrenal glands, which seems like it wouldn't be that big of a deal, but it can absolutely drop you dead at any moment if it's not caught. It does have symptoms that lead up to it, but adrenal failure is a pretty serious medical crisis. And most autoimmune conditions run in twos. That's kind of the trick in the medical field, is they say that like they come in couples. So if you have one, you're more than likely to end up developing a secondary,
like rheumatoid arthritis or something like that.
Yeah, or type 1 diabetes, Sjogren's syndrome, sometimes things like MS, stuff like that. But there are certain conditions. In my case, I'm at a risk of developing just sort of like an autoimmune polyendocrine syndrome, where there's multiple endocrine glands or organs that have been affected by my body's own autoimmunity. So I'm at a high risk of the Addison's and of type 1 diabetes.
And so you take meds to help manage those?
Well, so right now I'm on hormone replacement therapy.
Okay.
So I'm on good old HRT, which is something that most women don't have to touch until they're menopausal, but I am postmenopausal.
You went through that.
At 30, now 32. So I have to take that every single day, and that includes a patch that I wear in my skin that provides an amount of estrogen to my body that my body is supposed to be creating if I had ovaries that had not been destroyed by my own immune system. And then for several days a month, I have to take progesterone as well to kind of create what would be considered to my body the normal menstrual cycle. So the hormones trick my body into believing that it's normal, basically.
Gotcha.
I do take a lot of supplements as well, including things like DHEA and some other immune supportive supplements and hormone supportive supplements. You can't really prevent the autoimmunity from spreading. So there really isn't any kind of empirically supported way for me to prevent an additional disease process from occurring.
Yeah.
I can and I do live a really healthy lifestyle. I eat a ridiculously clean diet. I exercise ridiculously effectively. I'm like one of the most sober living, cleanest living people I know, and like it's kind of a joke amongst my friends that like you're not gonna catch me drinking or doing anything, because I just have to be really careful. And amongst, a lot of my clientele and sort of the autoimmune community, that's kind of the case. We all get used to being really, really behaved in our lifestyles. And those things can have supportive factors or can protect to a certain extent, or may prolong better health or support better health even if a secondary condition occurs. And the reality that I've come to accept and continue to practice accepting every day is that I can't stop the wildfire.
Yeah.
I can hope to contain it, perhaps, and then acknowledge that sometimes the wildfire is a natural part of the process.
Totally. Yeah. So when you experienced all this, where did you turn for support? Where did you turn for education?
Yeah. Friends and family were big supporters. I'm a big fan of support groups. I think they're a wonderful process. I'll own my bias here. Obviously, I think therapeutic processes in general are an awesome thing. And I'm sure you share that bias with me, Braxton. I those are the kinds of resources that I connected with. I think that I love support groups, especially for the infertility community. I think because it can feel very isolating. And regionally, as well as sort of nationally, internationally, there's not necessarily a lot of high exposure to conversations about these issues. So I think that isolation really needs support. And so I think the support groups are something that I'm really a big fan of. And actually, I co-facilitate a support group for women with chronic health conditions that I really value. And that's been going on for a couple of years now.
And does that happen over at Red Willow?
Yeah, that happens at Red Willow. It's on Monday nights. It's called Embodied Strength, and it's a group for women who identify with chronic health conditions, and got people from across the board in terms of experiences and disability. I did a lot of educating for myself as well. I'm a sponge. I think one of the things that I've always to be completely transparent, some of it is related to my intrinsic nature of being anxious. Like I'm a very good anxious person, if there is such a thing. I'm the kind of anxious that, I think on another podcast I once heard that like depression will keep you in bed, anxiety will get you out of it. Mm-hmm. And I am that person who will get out of bed even when I'm suffering and will like get my hands dirty to try to understand the nature of the problem. And so I went into this like 6-month kick of hyper education to try to understand my condition, infertility in general, what the treatment options were. It became kind of my hobby for 6 months.
Like Googling it, or are you talking deep Utah web?
The dark. I hit the dark web to find out about infertility. Lots of well-reputed websites. There's a lot of really good ones out there that do have a good reputation. Books. So Amazon Prime was a real pal during that time. Product plug. We're not being paid for that, so we can edit that one out if we need to. That would be a good sponsorship, right?
I know.
Lots of education. I'm a very do-it-yourself kind of person. Mm-hmm. I value seeking support from people who have experience and wisdom. And I also value building my own base of wisdom. So I did a lot of that. I saw an acupuncturist who was amazing and specializes in fertility issues and women's issues, and looked into like traditional Chinese and Eastern medicine. I really ran the gamut across the board of trying to figure out what my options were while I was beginning to see a Western medicine fertility specialist.
Nice.
And bounced over a couple of them with the University of Utah clinics before I kind of found a good fit.
Nice. So you were able to find all the different things that work well with you, from Googling to just Amazon, everything.
Yeah. I just, like I said, I really went to Hyperdrive with finding the resources. In retrospect, now it's been about a year and a half since I got my diagnosis, and I've definitely found a more reasonable pace. It's kind of, when you start running up the hill, you're gonna the minute the gun goes off, you really punch it, right? Like you come off the line hard. And oftentimes, if you're not careful, you can burn yourself out. Mm-hmm. And I came off the line really hard. I hit the ground running at first. And I think that part of that was because I felt really powerless, and I felt really devastated, and I felt really out of control. Mm-hmm. And I felt like this, becoming an expert on my condition and on infertility was a way that I was going to feel in control again. So I can understand the psychological mechanism of why I hit the ground running and kind of why I sprinted for a while. And then I realized that the pace was not going to be sustainable, and that I needed to sort of step back and slow down and really kind of examine some of the deeper issues and some of the needs that I was trying to answer to from the start, and not rush into any decisions, but really explore my options mindfully.
So what's some of the education pieces you found most important, or the things that you start to teach individuals now? So that the education pieces that I really found important for me, I think trusting my gut, oddly enough, was kind of one of the first things that I discovered along the way. Learning how to be my own advocate. And that's something that I really support, not just with clients, but with other, people I encounter out in the world who are dealing with not just infertility issues, but medical concerns in general. Doctors don't know all the answers. Mm. You are the expert on you. And if I'm taking the time to really learn how to be at home in my body and how to understand it and how to hear it, then it probably serves me to believe that my expertise is relevant. And if something doesn't feel right, look into it, speak up, let your voice be heard. You don't have to sit in silence. And I think that discovering that along the way was really powerful for me. People have asked me, like, if you could have gone back and told yourself the day after you got married any advice based on what you know now, I would have looked at myself and gone, look into it now. Don't
Like,
Yeah.
if it doesn't feel right, it's probably not right.
Mm.
You know, like if something's rotten in Denmark and you can smell it, like go check it out. And I think don't get angry and don't blame anyone along the way, because it's easy to do. I could have easily, blamed the ER doctors who just, sent me away with a migraine medication and said everything was going to be fine, or the dermatologist who said your hair is falling out. Maybe we should look into that. Like I could have foisted fault onto any of those individuals, but more importantly, the bigger message was that I needed to hear me. And that's one of the things that I'm a big supporter of with clients and everybody is learn how to listen to your body, learn how to listen to your instinct, your intuition, because you got it. Mm-hmm. Yeah. And I think that's a big part of what we do as therapists anyways, is we're not meeting with clients and saying, all right, I got your answers. Yeah. You just got to pay me enough to get them. Yeah. Contrary to popular belief, therapy is not about me telling you how to live your life. It's about, I've told people who come to me for the first time, or who are coming to me and are in a place where they're in a lot of fear, and maybe it's because of infertility, or it's because of their health conditions, or whatever else is going on for them. And they may ask me, like, what is this all about, this whole therapy thing? And it's like, well, you're stuck in a dark cave right now, and you pull your foot up and there's like something sticky stuck to it, and you can hear some dripping, and you can swear there's like bats flying above your head, and you can't see an inch in front of your face. And my role is to just come into the cave with you, strike a match on a rock, light a lantern, hold the lantern, and just walk with you. And we're just going to look around, and we're going to examine the territory. I'm going to ask you, like, what is that thing over there? Does that look like somewhere we should go? Or maybe you're going to say, yeah, you know what? Let's check this thing out over here. And we're just going to keep walking. I'm not going to walk in front of you. I'm not going to walk behind you. I'm going to walk right there, keep pace with you, level and parallel to where you're at. And we're going to meander our way through the cave until we can start to see the light again. So that's what I do as a therapist, and that's what I needed, and I needed to provide to myself along the way, when I found myself in the cave as well. Yeah, to be allowing. Mm-hmm. That's so cool. Absolutely. What are some of we're talking about all these, you're being very candid with your experience, and this doesn't necessarily happen like we're talking about. We want to be able to have more conversations like these, but it can be such a taboo topic. Yeah. Is there... I don't know, how do we start owning this, or be able to, what are some of the taboo things that you've seen, or that we need to really get addressed? Yeah. At one point along the way, I kind of came up with this. I probably shouldn't give myself credit for this per se, because maybe I didn't come up with it. I could have accidentally stolen it from someone, but the idea of fertility privilege, right? When we talk about like white privilege and class privilege and all that stuff, but the thought had crossed my mind of like fertility is a privilege, which is funny because the Supreme Court actually defines the ability to procreate as a right, not a privilege. But fertility isn't necessarily a right. I mean, I have the constitutional right to procreate. I do not have the physical privilege to do that. Yeah. So that was something that I think connected me to this idea of kind of the social messages that we have attached to it. I sometimes make the somewhat crass joke that if I had this condition 100, 200 years ago, I would be banished from the village and probably stoned to death, because I would be considered kind of a useless woman. Like I would be, a spinster, as they would have said back in the day. A spinster. Yeah. And of course, those are words that we don't really use anymore, but we're not that far away from our history when it comes to what we believed about that. And it's only been a few generations past that a woman in my state would have really been devalued to the point that she probably would have lost all of her social capital if she even had any in the first place. And, probably, could have very well have been left by their spouse, left without resources, because of the inability to create children. So I think that there's this really powerful implicit expectation for men and women that of a certain age, certainly, especially, that you're going to be able to do that, and that's expected within your time span. And one of the things that I had also figured out along the way that kind of popped up to me and that I share with people is that I felt like a part of my story had been deleted. Because I was in my 20s and I thought, I'm going to get married and then I'm going to have kids and I'm going to build a career and, all these things. And making a family was one of the big five, right? Like that was one of the big things I was going to do. And
that's what you start life kind of living in a sense. I mean, you're playing, besides doctor, but going in and playing house, you take on the roles that you've been assigned.
Exactly. Yeah. I mean, it'd been so socialized to me, especially as a woman, that was my role, to mother. And to have that the ability to do that in the traditional way taken away from me really did feel like a chapter of my story had been torn out and thrown in the fire. And I think that a lot of that isn't necessarily just because I was grappling with the reality of a body that couldn't produce a child, but with the social reality of being a woman who couldn't produce a child.
Yeah.
And I think that it's important to really unpack the shame that we imply to men and women. I was thinking about this as we were considering this podcast of how many jokes we make about sterility and about, not being able to have children or being barren. I catch it all the time now in popular culture because
I don't doubt it.
Now sensitized to it. I'm constantly hearing jokes on television and on radio and comedians making comments about being barren or being sterile. And it's the same thing for men. It's like, if you're sterile as a man, you're not considered a man, quote unquote. Like it totally.
Yeah, that gets you so hard to be, again, in that place for being a guy, being a woman, that you can't have kids.
Yeah.
And from what we were talking about earlier with the 20% that experience infertility issues, we constantly see individuals come in being like, I'm not a man, I'm not a woman, I can't create this life. And then on top of that, it's not foreign for someone to come up and say, when are you having children? And it's like, I just met you like 5 minutes ago.
Yeah.
I have clients that ask me that.
Yeah.
That it's really looking for connection, maybe in a place or something like that. Just really want to know. It's like, hey, let's talk about something. And we assume that everyone wants to have kids, and we assume that everyone can have kids. And then, you can get that, you field that question from everywhere, and it's in popular media and everything like that. Absolutely. And we need to be more open and understanding that it's possibly not a choice for someone, and the other place is that it could be something that is a desire, but can't be, grappling with that inability to have children.
Yeah. Now when I get that question from people, when are you going to have kids, or how come you haven't had kids yet? Perhaps it makes people uncomfortable, and maybe it's a pretty radical approach, but I'm totally honest with people now. If they ask me that, even just some random person at a store or whatever, do you have children? I'll say, actually, no, I'm not able to have children. That's just how I answer it now, because I think it's so important to, even if that, leaves somebody feeling a little disquieted or uncomfortable or awkward, I think it's really important for that reality to be something that's spoken to at some level. So I'm pretty transparent about that everywhere I go.
Do you find that April Fool's Day, like on Facebook and things like that, to be... I noticed there's a lot of pregnancy jokes.
Yeah. False pregnancy announcements.
Yes.
Yeah. In fact, every April Fool's Day, I post something on my social media about, like, please be mindful of the reality of, like, pregnancy loss, miscarriage, infertility, all of the things. There's different versions of this grief. I mean, people have stillborn children, people have miscarriages. I mean, I'm sensitive to all of those pieces because I think we all belong to that sort of tribe in some way. And fortunately, I think we're seeing more and more consciousness about these issues kind of coming to light, probably because of social media. The internet is this kind of interesting kind of creature that's constantly consuming itself,
Right.
but also as a result of consuming itself, producing something new in that process. And so I think there's an awareness that comes along that heightens, but I do occasionally see that sort of thing. And there's just a lot of social commentary that comes from the assumption of fertility privilege and a totally understandable lack of awareness about the 20% of humankind that lacks that privilege.
Yeah, it really comes down to, if you don't experience it, it's not in the forefront of your mind, that privilege piece where it's like, well, we make jokes about it, we can talk about it. I don't have to face it at this point in time, which is, in my certain situation, that's exactly where I'm at. You know, we're not necessarily trying for kids right now, but I know in the back of my mind, because I talk about this all the time, there's a 1 in 5 chance that I experience these similar things. I haven't had to. And so it's not at the forefront of my mind all the time. Probably more so than others, just because I'm a therapist that speaks about this stuff.
Yeah.
But it's real easy to just be like, oh, this is funny. This is different. I could get somebody.
Yeah, absolutely.
Yeah. So when we've got all these individuals that are worried about talking about these subjects, actually, one of the things I wanted to address that I thought was very interesting was talking to your kids about fertility, teens especially, being in a place where you could actually be in a situation where you run out of eggs before 25 or something like that, as well as men being unable to produce sperm after a certain age, and being able to freeze the eggs or freeze the sperm and be proactive about wanting to have kids later on. What do you know about that? What comes up in that?
Yeah, so diminished ovarian reserve is a very real possibility for some women, and sometimes it is related to concurrent health conditions. Other times it's genetic. They say on average a woman from the day she's born already has roughly about 20 million follicles in her ovaries in terms of the lifelong reserve. But there are genetic factors that can affect that. There are chromosomal factors that can affect that. Turner syndrome is an example of a genetic mutation that sometimes isn't discovered until, puberty. There are injuries that can happen for young men, like testicular torsion, other kinds of trauma to the testicles, testicular cancer for young men in their 20s can occur. So there absolutely are conditions where ovarian reserve and sperm count and morphology and all those things can be affected quite early in life. I think that one of the things that, I'm careful to not be alarmist about this issue, because I think especially when someone hears a story like mine, it can kind of shudder them a little bit and make them think, I need to run to the doctor and make sure I'm not the unicorn, right?
Am I the unicorn?
And so I think that there's a very important intersection between awareness and curiosity. I think I'm a big fan of curiosity as the antidote to fear. And so I think it's just good to talk to kids from a place of curiosity. And I'm a very sex positive therapist, so I believe in having these conversations proactively and accessing education for kids. I think that the belief that if we talk about it, it's going to make kids want to go out and have sex and then get pregnant at 16 is a misunderstanding. And it's not based on the reality. Psychologically and emotionally. I think we do a lot more harm by avoiding the conversations than we do by having them. And I think alongside the conversations about sexual health, we need to be having conversations about fertility earlier in life.
Which for parents can be completely fear-based. I mean, scary. Like, no, we're not talking about having a child at age 16. MTV has got that covered for us for 16 and pregnant. But again, you can bring in your own values. You can bring in and talking about pregnancy does not impregnate your child. Right.
That's excellent point, Braxton. We do have science to prove that that's the case.
Yes.
And I think that's a good point that you bring up, is that across the spectrum of whatever your particular lifestyle values and morals are, education is universal, and you can find a way to have the conversation that's framed in a way that honors those values. I mean, if you come from a cultural framework that strongly values marriage and sex after marriage and children, childbearing and all of those pieces, you can have this conversation as like, look, this is going to be an important part of the story for you. Let's make sure that you're healthy. Let's provide you access to the resources to be educated and mindful of your own well-being so that you can learn how to be your best advocate, learn how to trust your expertise about your body. Sometimes we discover the conditions or some kind of trauma occurs that forces the awareness to come into play. But, wouldn't it be nice if we could save one person along the way from having this part of their story torn out and thrown in the fire?
Yeah.
It can be done, and it can be framed in any way. I always say this to clients, like, you can deliver any challenge in a way that is kind and loving. I mean, I help to sort of work with people on their interpersonal communication, and we'll sit down and we'll figure out, how do you deliver a message that's really challenging and really confrontational in a way that's compassionate and empathetic, and it can be done. Wow. And it can be done from any framework, and it can be done to suit anybody's worldview, but it just takes awareness, compassion, and communication.
Yeah, I completely agree with you. When it comes to family member, friends, kind of backtracking a little bit, talking or wanting to be supportive, was there something that you found most supportive in friends or family members that wanted to be supportive but either found themselves withdrawing or being overly interactive with what was going on in your situation?
Yeah, I think it was interesting at first. I was pretty open, like I said, about what was going on, especially because a lot of our friends and family were like, hey, you're 30, you got married last year, time for a baby, right? So when I had to drop the bomb on everybody kind of collectively, the initial outpouring of love and support was gigantic from just including like people I hadn't seen since high school that were good friends of mine back in the day. And then it sort of dries up after a while. Like for the first few weeks, everybody's super loving and supportive. And then they have to go back to their lives, right? It's like taking a trip to Disneyland. It was amazing for the time that you were there, but the world doesn't stop just because you were in Disneyland. Mm-hmm. Like, things keep spinning, gravity keeps rotating, the magnetic north keeps shifting. Like, the universe continues on, and people's lives continue on, and that was tough to have that initial, really important, really supportive outpouring, and then to have people have to go back to their normal lives and to have a sense of being kind of left behind. Which that was where I needed to sort of step in and really be open to ask for what I needed. One of the things that I think was not super helpful, and I think is just such a natural mistake that people make, and that I have a lot of compassion for, is the, I think Brene Brown calls it silver lining.
Oh, at least.
Yeah. At least you can ... at least you can adopt, but at least you can focus on a vacation because you don't have to worry about getting a babysitter, or at least you can focus on your career. Ooh. Yeah. And it's just like, okay, I get that comes from a place of like, wow, you just told me something that scares me and makes me really uncomfortable, and I have no way to understand what you must be going through. Mm-hmm. That feels so heavy. So instead of just acknowledging how heavy that feels, I'm going to try to put a silver lining around it because that's more comfortable for me. Mm-hmm. I get where that comes from. I'm a therapist. I understand the nature of why we do that.
Yeah.
It's not helpful.
Yeah. The silver lining it. I believe that's Brene Brown saying.
Yeah.
They silver lining it. Not a verb, but I'm going to make it one.
Yeah. And it's just, so that's one of the things I always tell people is like, and I practice this for myself as well as kind of supporting people and learning it, is you don't have to understand how I feel. Mm-hmm. You just have to make room for it. And that's what I've had to communicate with friends and family who might have, out of really loving intention, try to paint that silver lining around my situation. Is like, look, you know what? I get that your intention is really loving. I get that you want the best for me. You want me to feel better. Of course you want me to feel better. Like, you want me to not be devastated right now. That is a really sweet, loving intention.
Yeah.
And I don't need you to fix it. I just need you to sit with me. That's all. Just make space. And that's, as a therapist, I understand that that's my largest imperative, is to just create space with people. So helping the people in my life to understand that that's all they needed to do with me, was to create space, was so critical. And I got to say, some of my friends and family and supporters just came through with flying colors once they figured out what it meant to be a good ally in just creating the space and saying, like, I can't even imagine what you're going through, and I'm here. And that was huge.
Wow. That's wonderful. It's good to know that the empathy piece is really, it's hard to go wrong if you're just being there to be with someone. Don't try and fix it.
Yep.
You can't fix it.
It's not broken.
It's not broken.
Yeah. I'm not broken.
Yeah, exactly. And that is probably one of the biggest important things to recognize, is that there's not a broken piece to be fixed.
Yeah.
Understand it can be uncomfortable to sit with.
Absolutely.
Yeah.
And I love it when allies and loved ones and family will say, this is really hard for me, because I don't know how to make it better. Like, partners, I think this is one of the conversations we need to be having along the way and educating about infertility, is partner support and family support, because partners are right there on the front line with you, and they are hurting just as much as you are, and they have no power. They feel so powerless. They want to make it better. They want to fix it. They want to heal it. They want to make it all go away, and they can't. And that is, it's just a whole different level of chaos emotionally. And I think that's that empathy and that willingness to say, this is really hard. And that's all that I understand about it, is that it's really hard. And I know it's really hard for you, and it's really hard for me. It's just really hard. And we're just going to be in that together is all it takes. It's so simple. Empathy is so simple.
Yeah. And it can take some time to try and master that initial reaction.
Absolutely. Yeah.
But yeah, it's not much more than sitting and being there.
I always think about this quote. Everybody throws around Rumi quotes because he's just like ubiquitous to some extent, but it's sell your cleverness and buy bewilderment. And I love that, because when it comes to something like this, I don't need cleverness. I don't need advice. I don't need fixing. I just need people to be like, whoa.
Yeah.
That's heavy, huh?
You're the unicorn.
Yeah. Whoa, that's heavy. Yeah, it is heavy. Thank you for acknowledging that.
Totally. Well, is there anything that you would, because we're talking to parents and parents of children that want to have these conversations, we're trying to build these conversations, what would you say the takeaway or the main piece that you want parents to have in conversations, or what do you want them to know?
Yeah, I think start by educating yourself as a parent about how to have the conversation with your kid, facing your own fears about having that conversation, how to frame it in a way that's congruent with your family's values and the way that you communicate, and try to acknowledge, not avoid. And I think that there's a lot of, there's so much easy access to information, and there are a lot of conditions that can occur for men and women that can create infertility or can complicate fertility. And it's very simple to find out the basic information about those conditions, and to get your kids into a general practitioner or an OBGYN or a urologist, when they're in their teens, in high school or whatever, to kind of advocate for their sexual health in general, but to also even just provide them the basic curiosity to consider, like, oh, I need to, alongside my general sexual health as it's developing, I need to also be thinking about, maybe I would want kids someday down the line. How do I make sure that I stay healthy, and that what kind of testing and sort of proactive health measures do I need to be involved in? And the testing is really not complicated. I mean, for men, it can feel a little strange. I mean, giving a sperm donation is an awkward. You get acquainted with the black couch.
The black couch.
Yeah, they're almost always black couches for some reason. It's an awkward little room with a black couch in it. But it's pretty straightforward, and it's we have the technology, so it's kind of one of those situations where if you have access to the screening procedures, it doesn't have to be a scary thing. I mean, we have all these vaccines and other phenomenon that we're advocating now to help teens, in supporting their sexual health, trying to teach them about HPV and STDs and all these things. I think, how come we can't include fertility screening as part of that process along the way? Even just giving people a pamphlet about it. Like, hey, maybe you're not ready to think about that, but when you're starting to get somewhere near it, maybe just go check some stuff out. Yeah. Or, hey, look, there are some symptoms to look out for. There are signs that maybe something's a little out of whack. These are the things to look for. Just be aware.
Right
teaching people to not to, jump at the red flags and go, oh no, like I need to freak out and go, see 15 different specialists, but just to learn how to identify them somewhere along the horizon. And does not have to react out of fear, but to just react out of curiosity and go, I wonder if maybe that's something I should check up on.
Nice.
If somebody would have said, hey, go be curious about your fertility, when I was in my late 20s, go check it out. I might have been able to avoid what happened. And I accept that I couldn't, and I accept that that's not how it happened. But, education is the way that we avoid those moments, and we avoid people having to lose the chapter.
Totally. Being able to just be curious about it and not be afraid of being at a fertility clinic, going and seeing a doctor and asking these questions. Yeah,
and for the basic screening, you don't even have to go to a fertility specialist. You can see a gyno or a urologist. I mean, a lot of general physicians of lesser intensity can provide those screening tests. I mean, for me, it was a couple of blood panels.
That's it.
Very, very simple. Yeah. And I mean, we are living in an era where insurances are getting more and more complicated, so it's hard to know what access points are going to be available. But if the access points are there, I think we serve ourselves to try to use them.
Yeah, totally. And then again, that advocate for yourself. You can call up your insurance individual or advocate and say, hey, what is covered? Can I go in and do this? Insurances have people standing by there to let you know what you can and can't do.
And to this day, at least currently, a lot of preventative screenings are still covered pretty well in a lot of circumstances. And so sometimes there's an opportunity that these things can be coded as preventative measures and may, so it might provide different access points to looking into those screenings.
Yeah. Well, this has been way fun. I really appreciate your story, as well as just the wealth of education you have on this topic. Really appreciate you being a part of Birds and Bees podcast.
Thank you so much, Braxton.
We'll have to do another one of these again.
Absolutely. Maybe it's about something a little bit less dour next time.
Oh, right? We'll come up with some other fun topics about sex and gender.
They're all fun.
Yes, it's a blast. Well, thank you again for joining us. I really appreciate it.
Thank you.
This has been another episode of the Birds and Bees podcast. Thank you for tuning in. If you have any questions about the show, comments, or questions you would like addressed in another episode, please give us a call at 385-449-1818. Leave your voicemail and your question, or you can also email us at birdsandbeespodcast@gmail.com or visit us online at birdsandbeespodcast.com.